When I was getting ready to graduate, I was trying to decide what my life would look like.
I am Dr. Stuart's mom. I've seen her go through medical school and all the way to where she is today.
I'm a little independent. I like to have a relationship with my patients. I'm a team player, but I also like to have my hands on. I never went into medicine to become rich. I wanted to pay my bills and I wanted to have enough money to travel occasionally and certainly to be comfortable and to be able to retire someday. But unfortunately, the model has become antiquated and really isn't working. I love what I do. I love my interaction with my patients. I love helping them when they need me. I love helping them be the best they can be, but I would love to practice without the bureaucracy of a third party.
6 or so years have been extremely challenging because of the number of patients she has and all of the paperwork and the bureaucracy that has happened in the medical field.
When an insurance company dictates what I do with my patient and they're not sitting in the room and they haven't been to medical school, they haven't had the training, I find that quite disturbing. It makes so much sense to me to take the insurance out of our relationship and to provide patients access to their doctor at any time when they need you is just incredible. And then to offer it at the price points that we offer it that are fair to the patient and to the practice, I think is an amazing concept. The 7-minute average in and out the door, the oh by the ways that you really have to turn around and say, I can't really talk to you about that today in a traditional model. You don't have to leave. You can stay and you can deal with what really needs to be dealt with that day.
It's a joy to her to know that she's going to be able to actually practice medicine in a preventative way.
For anyone that wants to take charge of their lives and of their schedule and to take charge of their practice and to really practice medicine like they used to, like practice, you were supposed to practice in the way medicine really was back in the 50s and 60s. I would definitely recommend it.
I think it's the light at the end of the tunnel for her, and I think that it's the idea of seeing her patients, giving them her undivided attention, which she has always done, but yet letting them see the value of what can happen if they start preventative now, rather than wait till something happens to them and then it might be too late.
I think my patients should stay because I've provided really excellent care to them up to this point. I truly believe that this is in their best interest, and I think that patients that have been with me for a long time know that I wouldn't change my model for any other reason other than it benefits them. They're going to get the same care that they've always received. They're just going to get an elevated version of that. Much better access, which has been a problem in the past in the traditional model. Same-day appointments and access to me on the weekends, which is an amazing benefit. Not having to utilize urgent care or the ER for unnecessary, non-emergent visits.